Hello and welcome, everyone. I'm Erin Ryan from the Massachusetts Health Connector. I will be facilitating today's session. I'm joined by my colleagues, Shaitra Sanders and Nikki Conti, and we are here to help answer any questions you might have. I would like to take a moment to thank chambers, business organizations, and brokers across the state for their support in promoting today's webinar. Before we get started, just some information about our presentation format. Everyone's audio has been muted and video has been disabled. The presentation portion will last approximately 30 to 45 minutes. Then we'll have time for a question and answer period at the end. If you would like to ask a question at any time, please use the Q&A functionality at the bottom of the screen. We will be monitoring questions throughout. Please do not disclose any personal information or protected health information when you ask your question. We will not be able to answer those questions in full detail on the webinar. If you have a specific personal scenario that you would want to discuss with someone, we'll be providing contact information for the Health Connector's customer service centers and instructions on how to find free help from a local broker or a navigator. Also, we are recording today's webinar. Following today's presentation, you'll receive an email with the presentation, so there's no need to take detailed notes. But again, thank you for joining us, and I will hand it over to Shaitra to get started with today's presentation.
Erin, thanks so much. I'm really excited to give a presentation today on the Health Connector for Business. And just to let you know, Nikki and I will be teaming up today, and we're going to be providing information to any business owner on here and what they have available for themselves and their employees. So I'm going to talk about what's available for Health Connector for Business, which is for employers with 1 to 50 full-time equivalent employees. And Nikki's going to talk about what's available on the individual and family side for those who might be sole proprietors, owner only, family-run businesses that might not have any employees who do not have ownership, and also for any individuals who might not be benefit eligible through the employer-sponsored coverage. So I'm going to turn this over to Nikki really quickly, just to give you an overview of the Health Connector and what we'll be talking about today.
Thanks so much, Shaitra. And again, thank you everyone for joining us today. So we do have a packed agenda. I'm going to go over what the Health Connector is, and then Shaitra is going to be diving in and talking about Health Connector for Business, and very specifically talking about savings, your choices, and really how to get started. What I will do in the second part of the presentation, as Shaitra mentioned, is I'll talk about how to get health insurance coverage if you're a sole proprietor or owner only. So as I said, lots to cover. So moving right along, for those of you who aren't familiar with the Health Connector, I think we just want to orient you all. The Health Connector is the state's health insurance marketplace. So as Shaitra mentioned, we're here to offer individuals, families, small employers access to affordable health insurance coverage. So the platform for businesses, those with 50 or fewer employees, is known as Health Connector for Business. And then people who don't have access to affordable health insurance, either through their job, a spouse's employer, partner, etc., those are the folks that could apply on the individual and family side. Now, really important, and I'll be going over this in more detail in further slides, there are many more savings available for people. Through the American Rescue Plan and the Inflation Reduction Act, we're able to offer more dollars back to the consumer, so they're paying less on their monthly premium. And then Shaitra and I always like to remind one another, we always talk about health insurance coverage, but we also sell dental insurance coverage. As you can imagine, that's part of someone's overall health. So going on to the next slide, just a couple of thoughts here, because myself and Shaitra will both be going through this information in much more detail in other slides. But I think most importantly, we want to really reassure everyone that all of the plans sold through the Health Connector, whether they're on the individual and family side or Health Connector for Business side, all of these plans meet state and federal coverage standards. So these are comprehensive benefits. You never need to worry that any of the plans that you've purchased through the Health Connector, whether you're an employer or an employee, may result in some type of penalty. So with that, let's talk a little bit about the plans that are available in selling through the marketplace. Okay, so you might be wondering, all right, this sounds great. Who's participating with the Health Connector? So we're able to offer plans through the leading insurers in Massachusetts. So on the Health Connector for Business side, there are exclusive cost savings, flexible choice benefits. On the individual and family side, depending on someone's eligibility and their income level, they may be able to see great subsidies, great savings through a subset of these carriers. So again, very happy to be able to say that these leading insurers are participating on mahealthconnector.org and through our platforms, both for individuals and families, as well as small business. So I will hand it over to Shaitra now to talk very much more about I was going to call it HCB, but Health Connector for Business.
Problem. Thanks, Nikki. And Nikki will be back on in a little bit to talk about what's available for anyone who's a sole proprietor or owner only. So just to confirm, I'm going to give you an overview of the Health Connector for Business. That's the small business health insurance platform that's available to small businesses located here in Massachusetts with at least one full-time non-owner employee up to 50 full-time equivalent employees. And through the Health Connector for Business, we are proud to look at the benefits that are available through the Health Connector for Business. And we've got a lot of feedback from employer surveys, broker surveys, and just really found out why do employers like coming to the Health Connector for Business, and what do we provide that's different from elsewhere in the market. And so these are some of the key points that we've learned back from these surveys. And one of them is that we're a one-stop shopping solution. As Nikki pointed out, we are a health insurance marketplace. So through the Health Connector and the Health Connector for Business, you have easy accessibility to all the leading carriers here in Massachusetts. And that is in one location, online, and available for you to look at in one spot. So very, very easy to shop around for the right plan for you and your employees. We have also found that through this one-stop shopping solution, small businesses actually wind up saving on average about 20% before any of the rebates that we offer. And the reason for that is because it is one location with all the leading insurers. And since it's an online tool, you can easily compare the costs across carriers, across plans, and make the best financial choice for both your business and your employees. We also have some great options that provide money back, and those we'll talk about in a little bit more detail. But one of them is a wellness rebate program where employers can actually receive back up to 15% of what they contributed into their employees' health insurance premiums while promoting wellness within the workplace. And there's also a small business healthcare tax credit, which I'll talk about in the future slides, but there's also an opportunity for employers to receive back some financial incentive for offering health insurance to their employees. We also have this great exclusive model called the Employee Choice Model. It is only available through the Health Connector for Business, and the goal of it is to allow for employers to create a cost control constant while providing their employees with several options of health plans that are available to them, therefore allowing their employees to choose a plan that best suits their needs while providing a budget for the business on what they could afford to put into the health insurance premiums. Also, to let you know, there is no fees for utilizing the Health Connector for Business or the Health Connector. On the Health Connector for Business side, we also have free certified assistance. So if you need help with getting the health insurance plan set up for your business, you can reach out to any of our over 500 certified brokers that are available to help. These are independent brokers that work within your community, and they are free for you to utilize for any Health Connector for Business related item. And again, there is no membership fee or dues to utilize the Health Connector. Also, just to reiterate that, as Nikki stated, all plans on the Health Connector and Health Connector for Business are compliant with state and federal law. So they meet the state's minimum credible coverage standard, and they have received the Health Connector seal of approval for quality and value. So just a few highlights I just want to point out about our Health Connector for Business plans. All of the carriers on the Health Connector for Business, so the leading insurers that we offer, have a health savings account compatible silver plan. So if you're a business that also has a health savings account benefit offered to your employees, those employees who are enrolled in that health savings account plan can find a health savings account compatible plan on the Health Connector for Business, therefore putting two benefits together and providing your employees with more benefits. We also have out-of-state coverage. So through the Health Connector for Business, employers can offer their employees PPO plans through our one carrier and our one level model, which I'll talk about in more detail soon. And as Nikki stated, we will talk a lot about health today, and it's automatic that it comes out, but we also offer standardized dental benefits through the Health Connector and the Health Connector for Business. And those are through our Altus and Delta Dental. So I stated earlier that we have an exclusive way of offering health insurance to small businesses and their employees that allows their employers to control the costs and give their employees choice in what they choose. And those are called our employee choice models. And as you can see, the whole goal of it is to allow for you as a business owner or business decision makers to really look at the cost of what is going to be for the business and to provide some kind of budget there, while providing your employees with multiple insurance options so that they can go online, compare what's available to them, and make the decision that they need based on their health needs and their own financial needs on what they would like to pay into the premium. And those employee choice models are called one plan, one carrier, one level. So this slide that I have up right now really kind of goes into the details of it from a health insurance kind of view. But what I like to do is I like to take this explanation that you see on the screen and I like to compare it to pizza. So let's talk about one plan, one carrier, and one level as if you were sharing the cost of a pizza with your employees. So let's talk about one plan first. One plan works this way. Imagine you and your employee decide to share the cost of a pizza. Your employee is going to get this pizza, the whole pizza, but you as the business owner or business decision maker decides that you're going to share the cost of this pizza with your employee. And the way one plan works is you say, you, to the employees, can get a pepperoni pizza from the pizzeria down the block. This pizza tends to cost $10. You look at the cost of this and you decide as a business, you're going to pay for half of it. So the employee will pay for the other half. So this employee will get a pepperoni pizza from the pizzeria down the block, because that's what you've chosen. You'll pay for $5 of it, and the employee will pay for $5 of it. In the end, the employee will get that pepperoni pizza. And so when we think about health insurance, this is how the one plan works. You as a decision maker decide what health insurance carrier you're going to offer your employees, the plan from that health insurance carrier that you're going to offer your employees, and then your employees will enroll in it and pay other portion of whatever you contribute into that plan, or they won't because they have health insurance elsewhere and they'll waive because they have health insurance elsewhere. So every employee will have access to the same exact plan, and all employees who need health insurance will enroll in the same exact plan. And I just want to let you know that this one plan is not exclusive to the Health Connector for Business. This can be bought elsewhere where you can obtain employer-sponsored coverage. So one plan is not exclusive to the Health Connector for Business, but one carrier is. So how does one carrier work? Let's imagine, again, you're sharing the cost of a pizza with your employee. The employees are going to get that pizza. So what you say to your employees is you say, you can get a pizza from the pizzeria down the block. We've looked at the menu and we have decided that as a business, we could afford to pay for half of the pepperoni pizza. The pepperoni pizza costs $10, so we can offer to pay $5 into each of those pizzas. Your employees will then look at the menu from the pizzeria down the block, because that's the pizzeria you've chosen, and they will look at the pizzas that are available. Some employees might choose the cheese pizza. The cheese pizza might only cost $8. Well, you've already budgeted the business to pay for half of the pepperoni pizza, so you're paying $5 into it. So those employees in this case, who choose the cheese would pay $3 because they pay the other portion outside of your $5. Maybe some employees might want the Supreme Pizza. The Supreme Pizza might cost $15 from this pizzeria. So they have your $5 that you budgeted towards the pepperoni, and they'll pay the other $10. Or maybe some of the employees will just buy the pepperoni pizza and they'll pay the other $5. What it allows is for you to control where the pizza is coming from, which pizza your business can afford to pay into, and then the employees can choose the pizza that they like and pay the difference outside the one that you budgeted for. And so when you look at that from a health insurance thought process, you choose what health insurance carrier you're going to offer all your employees. You look at the benefits available from that health insurance carrier, and you pay into one of the plans available, a contribution percentage, and then the employees can then buy the benefit that they need for their family. Some employees might need more coverage than other employees, and therefore they might buy a higher level tier than their colleague. What it allows for your employees to do is choose the plan that they need. So for instance, let's say right now you are offering a one plan option maybe somewhere, and maybe you're paying into a more comprehensive plan and you're paying about $1,000. So we're looking at plan A. Maybe this is what you're offering right now if you're offering health insurance. If you offer the one carrier model, what you allow for your business to do is to possibly pay into plan B, which is a less comprehensive plan, which will cost you less money as a business. And then your employees can still buy within that carrier. And those who need a more comprehensive plan can pay for the difference. And those who don't will just pay for the difference. So it really allows for you as a business to control your costs into the plan that you could afford from that carrier. So one level is our other exclusive option that's available through the Health Connector for Business. And this works very similar to one carrier, except in this case, you're going to choose what type of pizza the employees are going to have access to. So still stands, you and your employees are going to share the cost of a pizza. Your employee is going to get the pizza. What you say in this case is you tell them you can have a pepperoni pizza. So you have decided what type of pizza they can have. Then you look at all of the pizzerias in the area and you decide that the pizzeria down the block has a pepperoni pizza that the business can afford to pay into. It's that $10 pepperoni pizza. So you're going to pay $5. And then the employees can now look at the pizzerias in the area that are available to them and buy a pepperoni pizza from whatever pizzeria they want, and they pay the difference. So pizzerias will charge different prices, obviously, for ingredients and whatever other expenses go into them. So all the pepperoni pizzas may cost different prices within the offerings. What you're allowing is for the employee to buy the pepperoni pizza from the pizzeria of their choice. And so when we look at that from a health insurance idea, you are choosing the carrier plan, you are choosing the benefit and then choosing a carrier's plan from that benefit. And then the employees can buy across that benefit tier and choose the one that has their doctors in the network, because that's what will differ from different carriers, the network. So one employee might go to a certain hospital and another employee might go to a different hospital, and not all the carriers will have those exact ones. It will allow for you to just say, pick the carrier's plan that has your doctors in the network. And so what you see here is if you are offering health insurance right now, you might be offering a large network plan that's costing you as a business a little bit more, maybe the $1,000 over here at carrier A, so that you make sure that all your employees have access to all their doctors and hospitals as best as you can provide through a one plan maybe solution. But you can also utilize one level, save the business some money and pay into maybe a more narrow network, which will cost the business a little bit less, but still allow for your employees to have access to their doctors, because they'll be able to buy across carriers and pay the difference outside the one that the business can afford to pay into. So that is the Employee Choice Model's exclusive shopping option through the Health Connector for Business. And now I'm going to talk about two ways of getting money back through the Health Connector for Business. The first one is Connect Well. This is our wellness rebate program. It is designed for employers who offer health insurance on the Health Connector for Business and have 25 or fewer enrolled employees. Now, remember, you could have 50 or fewer employees to participate on the Health Connector for Business, but the Connect Well is focused on those who have 25 or fewer enrolled employees. And to participate, employees choose from any of 30 pre-approved qualifying wellness activities, and they only have to complete one. An employer can receive a rebate for up to 15% of what they put into all their employees' health insurance premiums if 33% of those employees complete one of the activities uploaded and are approved. Once an employee is approved, they'll receive a $100 Visa gift card. And again, they can choose from any of the 30 plus pre-approved qualifying wellness activities. Once you're enrolled and you are eligible to participate in the Connect Well program, we assist you in helping to get the word out to your employees to participate in this program. So if you are eligible, you do not have to ask to be enrolled. We will auto-enroll you. Then we will notify your employees by mail every other month to remind them to take advantage of this and get their $100 Visa gift card. Once an employee completes an activity, uploads it online, and gets approved, they will immediately receive a $100 Visa gift card through their email. And once your group has reached 33% participation, we will update you and let you know at the end of the year, look for some forms from us because you'll be receiving a 15% rebate at the end of your benefit year. So we definitely promote it along the way with you and also ask for you to remind your employees to participate. And just to let you know, this is a real rebate. So prior to, doing, the remote work and everything, we went out and we presented some employers with their Connect Well check. And this employer, Marcy Berger from Clean Property, said, we heard that there would be a 15% rebate. And I said, yeah, I'll believe it when I see it. And here it is. So we brought her check for her Connect Well rebate. We did bring a smaller check too, so she could cash it. But it is a real check and you can get back a nice size amount of money for promoting wellness within your workplace. There is also another way of getting money back, and it is called the Small Business Healthcare Tax Credit. And the Small Business Healthcare Tax Credit is a federal tax credit. So I don't talk too much about this, but what I always suggest for employers to do if they offer health insurance through the Health Connector for Business is at tax time, you should mention to your tax professional that you offered health insurance through the Health Connector for Business, because one of the requirements for being considered for this tax credit for up to 50% is to be enrolled through a state small group marketplace. So Health Connector for Business is the state's health insurance marketplace for small businesses. So that is a requirement. Your tax professional will then look at the other items that are required on there, such as covering at least 50% of the cost, having fewer than 25 full-time equivalent employees at an average salary of $56,000 a year or less. Those we do not look at because we don't look at incomes on the Health Connector for Business, but your tax professional does. So please, if you do offer health insurance with a Health Connector for Business at tax time, bring it up with your tax professional to see if you're eligible for the Small Business Healthcare Tax Credit. So now I've told you about all these great exclusive benefits and options with the Health Connector for Business. How do you go ahead and get started? Pretty simple. You go to www.mahealthconnector.org/business. You'll see this screen. You can go in here, try to get a free quote, create an account, get started, review all of these items that I just reviewed with you. But I do want to let you know there are some deadlines. So just to make you aware, small businesses can offer health insurance to their employees for an effective date on the 1st of any month. So there's no open or closed enrollment period. And so, for instance, if you start health insurance on July 1st, then your employees will have a benefit year that goes to their renewal date, their anniversary date. So if you offer health insurance with an effective date of July 1st, you will then renew on your anniversary date the next year of July 1st. But just to let you know, when you're offering health insurance, the prior month is considered your open enrollment period, and you have a few deadlines. So you'll come on, you'll visit the website, you'll create an account, you'll put together a one plan, a one carrier, or a one level, and you'll offer that to your employees by the 10th of the prior month. Then your employees will be notified via email to create their accounts, and they'll go online and they'll shop, and they'll need to do that by the 20th of the prior month to the effective date. You'll need to make the online payment on the 23rd of that prior month, and then boom, it will start. Your health insurance for yourself and your employees will start on the 1st of that month following, which is the effective date you were goaled for. And I stated really early on that you do not have to do this on your own. You can. It's a very self-service model that is easy to complete. Again, it's online, very easy to compare. But if you don't have time for that, or if health insurance is not something that you want to put as an extra responsibility on your plate, we have certified brokers within the community. We actually have over 500 certified brokers on the Health Connector for Business that can help you. They're free for you to utilize for any Health Connector for Business related item. They have access to put together really easy cost estimates that they can pull together and share with you and show you why they thought of these options for your business. This is their subject matter area expertise. Like, this is what they do day in and day out. So, they understand plan options. They could explain to you what is being offered. They can explain to you what your employees will have access to. And that will free up time for you to focus on what your subject matter area of expertise is, and that's your business. So let them do that, tell them what you need, and they'll pull together everything for you and assist you. So now, Nikki, I'm going to let you take over and just talk a little bit about what's available for sole proprietors, owner only, and those who cannot get health insurance through an employer-sponsored plan.
Great, thanks so much, Shaitra. And wherever possible, I'm going to actually just draw reference to like ways in which we're the same and ways in which shopping for individual and family plans is different. So going on to the next slide, I want to just acknowledge that open enrollment for individual and families has ended. However, that does not mean that people can't still apply for coverage and get access to coverage. So if someone has a qualifying life event, basically that opens a window for them so they can enroll in health insurance coverage when we're not in this open enrollment period. So these qualifying life events are things, ordinary things like a change in your household size, a change in address. Let's say you've moved into Massachusetts, or you've moved from one part of Massachusetts to another part, or you've gotten married, had a baby, adopted a baby. These are all qualifying life events. Now, when something like this happens, the rule is to report any qualifying event within 30 days of it happening. And then you have 60 days from the date of the qualifying event to take action. So you can either select a new plan, change a plan, whatever it is that you need to do. Now, when you are in the special enrollment period, and all the other rules are still in effect, but basically the special enrollment period just opens the door for you to come in. So going on to the next slide, how can you apply for coverage, individual and family coverage through the Health Connector? So you want to start with mahealthconnector.org. There is an online application, and people who should apply are Massachusetts residents. You need to be a U.S. citizen, U.S. national, or otherwise lawfully present in the U.S. And as I had mentioned way back at the very beginning, this coverage is for those who do not have access to affordable health insurance coverage, either from an employer-sponsored insurance, or a family member, partner, spouse. Also, if somebody is currently enrolled in Medicare, Mass Health, which is our state's Medicaid program, or other public health coverage. So as an example, certain veterans benefits meet the coverage standards. So if folks are in one of these plans, or if you're offered affordable comprehensive health insurance, you would not be able to qualify for a subsidy. So it's really, the platform is not for you. Now, going on to the next slide. You might be wondering, all right, what do I need to apply? So this process is a bit different because now consider we're only talking about you, the sole proprietor, or you, an individual or family. You're applying for family coverage. So you're going to need social security numbers for yourself and everyone who's applying. If there are any immigration documents, you want to gather those. We also need some income information from you to see if you could qualify for some help paying for coverage. So from a self-employment perspective, we need information about your net income. And if you didn't file taxes last year or the income changed significantly, just something that shows your current income. Copies of last 2 pay stubs, if that's applicable. If at any point during this year that you're applying, you have any unemployment dollars that are coming in, essentially, these are the types of things we would need to know about. Now, I've said this so many times, I'll always say this. If you do not have everything that is listed here, please don't hesitate to just simply apply. The system, actually, the online application is going to let you go through this process. You should provide as much information as you have available to you. And then when you get to the end, it's going to tell you if you're missing information. It tells you what it is that we need from you. And you'll also get a letter from the state indicating that we need proof of some particular thing. So going on to the next slide. I've mentioned briefly that there are savings available for folks. So I mentioned that the American Rescue Plan and the Inflation Reduction Act actually created more opportunities for people to save money when they're getting their health insurance coverage through the Health Connector. So this would come to you in a form of advanced premium tax credits. So these tax credits lower the premium amount that you would pay each month. And the way it works is the IRS is going to send that tax credit directly to the insurance company. So whatever it is that you qualify for, you can say, yes, that sounds right to me. Let's have that money go straight to the health insurance company, and you just pay the lower amount. Your premium gets reduced. Now, because these are tax credits, it's important for me to note that you do not have to take maximum credit. You could, in fact, adjust that amount and take a little bit less if you know that your income is going to fluctuate. Now, going on to the Connector Care program, this program is unique to Massachusetts. It takes the federal advanced premium tax credits plus additional state dollars, and those two together help reduce the premium amount that a consumer pays each month. So there are low monthly premiums, low out-of-pocket costs, no deductibles for these Connector Care plans. And depending on the plan type that somebody qualifies for, they may be able to choose from a $0 plan or a plan as low as $133 a month. Now, you might be wondering, okay, I'm not sure. Could this be for me? Do I need to go through the whole application to figure that out? The answer is no, you don't have to. You can go to our homepage. You can use the Get an Estimate tool, enter a subset of information, and the screen will come back and let you know whether or not, give you a sense, gives you an estimate of whether or not you could in fact qualify for savings. So great tool, certainly give it a look. I think a lot of people are surprised if they had applied before and they weren't eligible. I think they're very surprised that they can get savings now. So I won't spend a ton of time here other than to say that for the Connector Care program, there are income standards. So you can see those here. For example, for a household size of 2, the income limit is $51,720. So if you're making under that amount and your household is, there's only 2 people in the household, you could in fact qualify for Connector Care if you meet all of the other eligibility requirements. And then the column to the right here, where that says APTC, this is referring to advanced premium tax credits. And I'd already mentioned that the American Rescue Plan was basically providing more savings. And one of the ways it's doing that is it has removed the income limit from qualifying for advanced premium tax credit. So people with incomes over 400% of the federal poverty level may in fact now be eligible for their health insurance coverage. I'm sorry, may be eligible for help paying for their health insurance coverage. Sorry about that, folks. So going on to the next slide, similar to what Shaitra described, there is free help available if somebody needs assistance enrolling in health or dental insurance coverage. So we have a customer service center. This is separate from the Health Connector for Business Customer Service Center, and the number is listed here, as well as our TTY number. The phone number is 877-623-6765, and our TTY number is 1-877-623-7773. Also, we have a number of trained and certified navigators and certified application counselors. These are our community partners. They are there to help you, and again, for free. They are located in various communities across Massachusetts. Many speak other languages other than English and can really help somebody from the point where they're answering questions all the way through enrollment into health insurance coverage. But given that we're still, somewhat in a public health emergency and everyone has different needs, if you will, we always recommend that you call ahead to schedule an appointment. And depending on the organization that you call, they may be able to help you over the phone. They might be able to set up a Zoom with you, see you in person. Basically, you let them know what your preference is. On to the next slide. I'm going to hand this over to you, Shaitra. I always do this.
Why don't we do this together? Why don't we do this together, Nikki? Well, so I think the key, what Nikki and I have presented together is there are options for any type of small business through the Health Connector. I spoke in great detail about the Health Connector for Business, which is available for small businesses with 1 to 50 full-time equivalent employees and at least one non-owner enrolling. And Nikki spoke about what's available on the individual and family platform for those who might be sole proprietors, owner only, family-run businesses, anyone who might not be eligible as a business to enroll through the Health Connector for Business. And one of the things that we really like is that we have very similar deadlines. So we want to make sure that we are very easily aligned. And Nikki, what do you call it? Like an easy transition, depending on where your business is at?
Absolutely. I would think since Shaitra and I have been working together, we've always tried to tell folks, if particularly those who are starting new businesses, this is a great opportunity to essentially start on the individual and family side. You may be at a point where you're starting your business, you're not drawing an income. This is definitely something to take advantage of. And then once you grow and your business kind of gets off the ground, Shaitra, take it away.
Yeah, so we make this very easy. So for instance, Nikki said there's some deadlines for if you want to enroll on the individual and family side. And one of those key deadlines is your application still has to be done prior to the month that you want the effective date on. And on the individual and family side, if you're trying to get coverage because you can't get it through a business, everything has to be completed and paid by the 23rd of the month prior. So for instance, if you wanted April 1st coverage for your family and you couldn't go through a business plan, then you would want to have your whole application completed and paid by March 23rd to start on April 1st. Now, that March 23rd deadline is a deadline also on the business side. We just have a few more deadlines on the business side because you have a few more steps as a business owner to offer health insurance. But the key is on the 23rd of the month, you also have to make that final payment in order for your that initial payment for your health insurance for the business to start. A good thing about that also is, and Nikki, correct me if I'm wrong, the 23rd of the month. So say a sole proprietor does enroll on the individual and family side, and then they get a business and they have employees who want to enroll, and then they want to go on the business plan, they would cancel their individual insurance also by the 23rd and complete everything on the Health Connector for Business side by the 23rd. Am I correct?
Absolutely. So I think that's another way that this is this can be a seamless process when you're starting out as a sole proprietor and then maybe growing your business. So yeah,
or going opposite. or going up? Is it you no
Or
longer
going the
have
opposite, yes,
employees and you
yes,
just
we
want
have
to?
had that happen as well.
Yeah. So very aligned, and we are here through mahealthconnector.org to help you at any stage of your business. So I think the best thing now would be to turn to our colleagues who have been collecting some questions during the presentation, and hopefully we can answer some of those.
Yes, Erin and I are just getting those together. So let me just throw you our first one. So someone asked, what are the benefits of purchasing insurance through the Health Connector, both for business and as an individual?
That's a good one. So on the business side, I will say, and Nikki, I'll let you talk about what's available through the individual side. On the business side, we talked about some of those exclusive options, and that is definitely a great benefit. The employee choice model, where as a business, you can create a budget or cost control option while providing your employees with choice. So watching your budget while providing your employees with the option that they need, that's exclusive to the Health Connector for Business. The Connect Well, the wellness rebate program, where you can receive money back for promoting wellness in your workplace and offering your employees health insurance, is exclusive to the Health Connector for Business, as well as a small business healthcare tax credit, which is a federal tax credit that is designed for employers who offer health insurance through a state marketplace. The Health Connector for Business is the state's health insurance marketplace for small businesses. As well as, again, we are completely an online system with all the leading insurers in one spot. So we make it very, very, very easy for you to offer health insurance to yourself and your employees through the Health Connector for Business. And Nikki, I'll take it away to you for what are some of the great options through the individual and family side for those who can't get it through a business.
Yep. So some of these things are similar to what Chaitra said. There are things that are exclusively available on mahealthconnector.org for individuals and families. So one of those things is getting tax credits. So if somebody is interested in finding out if they qualify for tax credits, you need to go through a marketplace. And in Massachusetts, you have to go through the connector to get those tax credits. So that's the advantage. In addition to that, if you are in a lower income range and you meet all the eligibility requirements, you might in fact qualify for those connector care plans. And again, those are great plans, comprehensive benefits, and very low contributions in terms of, you know, co-pays, and there are no deductibles, etc. So I would say those are really the benefits. And then actually, I think I just thought of one for both. So as we had said at the beginning, all of our plans meet both state and federal standards for coverage. So you know that whatever plan you buy, regardless of the carrier, sure, they may vary, you know, depending on the plan design and the deductible, etc. But you know that you are going to get a comprehensive health insurance plan with us.
Excellent.
So great question. Thank you.
Yeah, thanks, guys. The next question is, are there credits or rebates for nonprofits?
Yes, so for a not-for-profit on the Health Connector for Business, which you don't have an owner for a not-for-profit, so you can offer health insurance with the Health Connector for Business. You can get all of that access to the employee choice models. You can participate in the Connect Well program if you are 25 or fewer employees enrolled. And the small business healthcare tax credit does notate that there are tax credits for not-for-profits. I don't think it's 50%. It might be a little bit less, but it's all detailed on our website at www.mahealthconnector.org/business. And it also will bring you straight to the IRS website that talks in more detail and has a calculator attached to it. So yes, there definitely are some money back benefits for not-for-profits also.
Excellent. The next question is, where, when selecting a plan, does a person see how much of a subsidy is applied to their premium?
So on the individual and family side, again, there are two ways to do it. You can do it at the outset before you apply. You can use the Get an Estimate tool and see if you might qualify for subsidy based on qualify for savings based on the information you've provided us, or as you're going through the application process, after you've entered all of your household information, you will learn whether or not you qualify for tax credits. It will tell you the amount. And then when you click on preview plans, you will see a number of plans returned in your area. And you will see, it will tell you that, you know, if you are getting tax credits, it will tell you we're applying this amount of tax credit to the health plans. So the pricing that you're seeing is inclusive of those premium tax credits.
And then similarly, are there subsidies applied to premiums for employers or employees receiving coverage through the Health Connector for Business, or is this just on the individual side?
So through the Health Connector for Business, the contribution percentage that the employer is contributing into their employees' health insurance premiums, that is the percentage that is bringing the premium down for the employees. Now, Nikki, and correct me if I'm wrong, those employees who might not be able to afford the premium of their employer-sponsored coverage might be able to apply for a Mass Health Premium Assistance that is separate from the connector. But of course, we can always provide a link to you to that website so that if you are offering health insurance to your employees and they might be eligible for this, they can seek that assistance. Nikki, do you have anything else to add on to that?
Yes, so this is a great question, and everything Shaitra said is correct. But in addition to that, remember, I mentioned that getting subsidy through the individual and family side is also based on affordability. So you might have a range. You could have a few employees, but there's a range of income that they're making, their salaries. There's a, you know, difference in the range. Anyhow, so if you have an employer who's on the lower income kind of spectrum within your group, and you're offering the same, you know, you're contributing a certain amount to everybody's coverage, but based on that employee's situation, their income, it just might not be affordable to them. So there is an affordability worksheet that you can use. And then also if that person had decided to apply for coverage through mahealthconnector.org, they would need to work with you to get, you know, information, details about your plan, what you're offering, what their contribution would be, and then the system will actually figure that out for them. So again, it may or may not be deemed affordable. So if it is not considered affordable, they could stay and get coverage through the individual and family side.
Thanks, Nikki.
Great. Next question is, can you just clarify one more time how the sole practitioner coverage is different from an individual plan through the connector?
Yes, if I could unmute myself, I would. Okay, so there is no difference. So if you're getting coverage, if you're a sole proprietor and you're getting coverage through mahealthconnector.org, there is no difference. It's essentially you're buying a health insurance plan through the Health Connector. Technically, when the ACA, the Affordable Care Act, was passed, it carved out that any sole proprietor couldn't buy on the small group side. They needed to buy on the individual and family side. But part of that was to, you know, to basically give them additional subsidy. So hopefully that helps answer your question.
Great, thanks. Next is, as someone who's starting their own business and expecting to be the sole proprietor when starting out, where should they first turn? Where should I first turn?
Start with me, no. Start with mahealthconnector.org. So on the individual and family side.
Awesome. Okay, next question. My business is in Massachusetts, but employees live in both Massachusetts and New Hampshire. Do these insurance options exist for both groups?
Great. So this is a great question. So as an employer offering health insurance, what you have to be focused on is my business in Massachusetts. That will make your eligibility. Now, your employees who live outside of the state, depending on what you are offering, you through the one carrier or the one level model, you can actually offer them options to enroll in a PPO. The PPOs allow you to go out of network, very good for those who live out of state. Now, when you're thinking about the bordering states, such as what you're stating with New Hampshire, if they wind up enrolling in a plan that is Massachusetts, then they would have to see the doctors in Massachusetts. So you have options no matter how far your employees actually live outside of their work area, either one carrier or one level for the options to the PPO, or if they live really close to the Massachusetts state line, then they can utilize the HMOs and see doctors within the network here in Massachusetts. So yes, you can have employees out of state on the Health Connector for Business plans.
Excellent. Okay, next question. Do all employees in a company have to enroll, or is there a minimum percentage of full-time employees that have to enroll?
So this is a great question. So on the Health Connector for Business, we have what is called a 75% participation requirement. But what we mean by participation requirement is we need at least 75% of the benefit eligible employees to either enroll or waive with a valid waiver. So for instance, let's say you have 4 employees and only one of your employees needs health insurance. We still need at least 2 other employees to create an employee account and attest that they have health insurance elsewhere, either through a spouse, a parent, Medicare, wherever else they have health insurance. That is a valid waiver. So we can cover up to 1 non-owner, just as long as we get the other employees to waive with a valid waiver.
Okay, excellent. The next question is, what happens when an employee leaves a company? Can they take their insurance with them?
So that's a great option, a great question. And there are options for them. So through an employer-sponsored plan, you can offer them COBRA coverage, which means that's continuing what they were already enrolled in. But then the premium will be their responsibility. So that full premium where you were helping before, that will now be their premium to continue the coverage for a certain amount of months that is available. There is another option for your employees if that is too expensive. And Nikki, I will let you talk on the individual and family side, what's available for those who might lose coverage through their employer.
Now, this is an important area, important question. So yes, there is the opportunity to go onto COBRA. However, if somebody is looking at that COBRA cost and now there won't be an employer contribution, that could be a significant surprise. So we think it's a good idea to just have somebody come to the Health Connector, use the Get an Estimate tool and see if they might qualify for some savings. So certainly we are a great alternative to COBRA.
Excellent. Okay, so moving on to our next question. Can we review qualifications and eligibility for individual enrollment and the important dates to obtain coverage by the first of a month? So maybe even going back to the slide.
Yep, you can go back to the slide if you'd like, and I can, as you're looking through that, I can just, okay. Let's go through this. Let's just talk about the dates first. So that's easiest. If you're looking for coverage to begin on the 1st of the month, you need to take all your action by the 23rd of the month. So right now we are in March, so somebody would be shopping for April coverage. Right now is a good time to start this process. If you are someone that's going to need to pay a premium, you're going to need to do that by the 23rd of the month. Really important to note, we do not take credit card payment. It's checking or savings only. You can pay online, you can pay over the phone, you can pay through mail, or even walk in person to one of our centers. Again, the deadline is the 23rd of the month for coverage that begins on the 1st of the following month. Now, in terms of qualifications, as I'd said before, someone needs to live in Massachusetts, they need to be legally present in the United States, and they need to be someone who is not offered access to affordable insurance coverage. So if somebody is enrolled in Medicare, Medicaid, or they have an offer of affordable comprehensive coverage from an employer, they would not be, in fact, eligible. What else? What did I miss?
I
So
feel you covered it.
we just say if you're uncertain and you need coverage, certainly just apply. There is no obligation. Actually, that's an important thing to say. There is no obligation.
And that's on both sides. So if you come over as a business and want to start shopping around, or if you go on as an individual and family, what you are doing is shopping around. It's not until you complete it and then you make that payment and then your invoices will start for coverage continuing.
Right. You're not committed until you make that payment.
Excellent. Okay, next question is, if an employee gets premium assistance, can you also access plans on the connector?
Yes, so this is something Shaitra had mentioned before. So if the Mass Health program, Medicaid, runs a program called Premium Assistance, and basically if the person is getting Mass Health and then the employer, this is very, very high level, but person is on Mass Health, the employer is now offering health insurance coverage, that employee could enroll in the employer coverage and Mass Health could help pay for that premium. So we'll follow up with a link to that site. So they're a separate organization from us. So they'd be great resource to just talk any employer through.
And Francesca, I just want to let you know that we're coming up upon the ending. So if there's like one definite really question that we should answer, can you bring that one forefront?
Yes. Let's see. I'm just going to try to make sure we haven't covered. Okay, this is a good question. So can a person review options several months before their renewal date if they would like to see cost and care options before committing to changing their current process?
So I'll let Nikki take the individual and family side. If you're a small business and you want to offer health insurance in the future, I just want to let you know that rates are different every quarter. So January 1st, February, and March all have the same rate. Then April, May, June have the same rate, and then the next quarter to quarter. So you can only really come about 60 days prior to the effective date that you're looking for on the Health Connector for Business to see what it would cost your business. But Nikki, that's different on the individual and family side. So I'll let you.
Yeah, so typically, I believe we're 2 months. I think you're able to see, you're able to look ahead and get pricing 2 months.
So the same, 60 days prior.
Okay, so we can, yes, if any haven't gotten that question in a super long time, but yes. I think we have 2 minutes left.
Yeah, if
Okay,
you have
excellent.
Anything else?
another.
We're ready.
Okay, I'll ask you one last question. So how does billing work if an employee is enrolled through their employer? How do the payments get taken out?
Okay, so through a business plan, as the employer, you are responsible for paying the full invoice that is generated in the Health Connector for Business website, and then you will set up payroll deductions pre-tax for your employees to take their portion out of their payroll. And that is how you set it up. And you can work with your payroll company with that, how you want to do that. But you as the employer is responsible for paying the full invoice and then deducting the employees' premiums from their paychecks.
Excellent.
And I think we've hit the mark. I think we've done great. I really enjoyed doing today's presentation, and I really was happy because there are some questions, Nikki, I think you'll agree that we haven't heard for a while.
Yes. So always glad to hear from, it sounds like there's a variety of people on the line, new businesses, grown businesses. So yeah, super happy. to be
Erin,
able
would you
to
like to
offer
take
this.
us out?
Well, absolutely. Well, thank you so much to everyone for joining us today. Shaitra and Nikki, Francesca, thank you so much for such amazing information for, as you mentioned, a variety of individuals with a variety of backgrounds and futures ahead of them. So thank you so much to everyone for joining us. Again, please reach out to the Health Connector for Business. The contact information is there on the screen. We will be sending this presentation around. So reach out with any questions, and best of luck, and thanks for joining us.